Yeah, so I continue with the private practitioner and the theory in which she is using to accomplish or accommodate her clients. Again, according to the behavior therapist behavior is a theorious behavior is a product of learning experience, and we as humans are not only a product of an environment, but the producer of our environment as well. We learn new behavioral through classic and operant condition. McLean 2007. Another connected assumption of the behavior theory is that all behaviors, both simple and complex, can be reduced to the stimulus response feature. Behavior is shaped and maintained by, in consequence, Can and Cantuas, 2008, page 134, para 2. A person's behavior can be reinforced, positive or negative, although typically positive reinforcement has a more um, significant impact. No matter how much work is put into changing or developing a certain behavior, the behavior can disappear if the reinforcement fails to appear. Overall, behavior theory stresses that a person is shaped by learning and environment. Heavy emphasis is put on current behaviors and treatment goals, as well as how to change undesirable behaviors. The general goals are to increase personal choice and to create new conditions for learning, and aim to is to eliminate mal, maldi, maladictive behavior and to replace them with more constructive patterns. Corey and Corey 2011, page 169, paragraph 4. The counselor feels that behavior theory aligns well with her own personal views and life history. Overall, it does not much in form differ from the Algerian school of thought. Both theories are of the belief that people can change their behavior and are the controller of their destinies. For the counselor, behavior theory is a good explanation of why we behave the way we do and how motivating factors throughout our lives play an important role in behavior. Now we're gonna look at the role of the theories with the clients. The counselor believes that blending of Algerian theory and behavior theory will be a successful for her client. For example, a person who has suffered from depression their whole lives can find um, through Algerian theory where her depression stems from, and the behavioral theory can help the client to change her behavior patterns. For a couple who comes for counseling due to commitment issues, Algerian theory can help them to determine, rather, why they have a fear of commitment, and behavioral theory can help them to see their situation in a different light and change the things that are not working for them. The counselor cannot see any instances where this combined practice would not be successful in helping any client she may treat in her private practice, counseling setting, and diverse background. Although, my friend, the counselor plans on using these two theories in a private practice, they can also be successfully used in other counseling venues as well. In a setting that caters to addiction, counseling behavior theory can be very successful um, in helping clients to overcome their addic- addictive behavior. The Algerian theory comes into play in identifying the root of the addiction. This can be achieved, my friend, through explanation of past family history and early um, recollection. Perhaps there is a life theme in the client that shows where the need for the addictive substance came into play. One theory of addictive behavior deals with adoption models and shows the way in which the addict's experience of a drug effects fits into the person's psychological and environmental ethology. In this way, drugs are seen as a way to cope, however, dysfunctionally with person and social needs and changes situational demands. Another venue that these theories can be applied is in school counseling. Many students suffer through problems at home that affect their performances in the school setting. Algerian theory can help to draw out these family issues, while the behavior theories can help in changing the student's behavior. The counselor feels that this is especially true for young people having family problems that affects their academic performances, while pinpointing the family issues through use of the Algerian theory may not change things at home unless the family is willing to enter into counseling. The behavior theory can certainly play a key role in helping the student to overcome these issues and see that while these cannot change the behavior of others, they can change their behavior and how they react to situation in their lives. Algerian theory and behavioral theory can be helpful for many different types of people. However, working with clients from diverse cultural background can provide a challenge in some situation. It does appear, though, that Algerian perspectives on cultural diversities are less rigid than their theories. This approach addresses cultural issues in both the assessment and treatment process. Algerian therapists encourages clients to define themselves with their social environment. Corey, 2009, page 119, para 2. Globally speaking, this theory fully recognizes the different aspects of culture, including gender, race, and religion, and works within the client comfort zone when it comes to theirs culture, belief, and differences. Though this is true, an Algerian approach, behavior approach, can present problem for people from different culture when it comes to um, behavior. There are many factors to consider, such as person, culture, belief, and how the client was raised. For instance, if a Hispanic woman was seeking counseling for her marital problem, it may be hard for her to embrace behavior changes techniques due to her culture views of women and divorce. One of the theories in which I embrace when I was doing my studies in counseling, I combined the Algerian theory with the feminist theory. I did that due to the fact that, as it stated, people need to be encouraged and to put them at a place where they feel and know that they are more than an overcomer and an overachiever. And the feminist theory, what it does is elevates women, and not only women, people who are marginalized, to a level playing field whereby they will be able to be better appreciated and recognized by those in that area of a career, practice, lifestyles, or whatnot. So, as a counselor myself, I subscribe wholeheartedly to the feminist theory and also to the Algerian theory due to those reasons. But I do also subscribe to other theories as well as the behavioral theory, so that an individual will be feel self-worth and whatnot. Again, I will continue and then I will just end off this comes to before I come to an end. Counselor's personal bias over. The counselor personal bias can affect the way she views a particular theory depending on her personal belief and value. As for the two theories discussed, the counselor is biased in that she feels that these are the most effective theories, and combined, she feels that the past must be explored in order to fix situation in the present and to move effectively into the future. She also feels that learned behavior can be unlearned and changed to make the client life the way they envision it being. There are also bias against certain theories. While the counselor is a woman, she feels bias against the feminist model and con- and counseling, as she feel is the too pushy and only can create and to a certain class of people. White women, middle class women, and other feminists are on the fence. Feminists. The counselor does not feel that any theory that cannot be somewhat applied to the general population is not as effective as it should be. Effective of Algerian theory of depression. Depression can occur due to various issues in a client's life, including relational issues, feelings, little self-worth, due to not being able to find meaning to their lives, or losing the loved one, just to name a few. Other causes of depression may be pessimistic thinking and lack of self-esteem, trauma survivors such as child abuse, crime, or natural disasters, or severe problems such as job loss, financial setback, poor health, or divorce. Um, we could look at why does depression 2007. Depression can occur due to a heavy amount of anxiety in one's life. For example, a person who is constantly bullied may suffer high anxiety and low self-worth and therefore suffer from depression. Algerian theory can be an effective means of treating clients who suffer from depression. Algerian theory basically tries to assist a patient to get over the inferiority feeling and make him or her fix realistic agendas and achieving them, which will contribute on their happiness and self-importance. Algerian theory um, operates under the assumption that humans are influenced by social agendas, which means that by using what motivates the client can lead to the end of depression. Once the client is able to view their environment differently and their self differently, then they can work to lift the depression and find happiness. Algerian theory counter-centers on application of personal psychological principles that are intended to make available to disadvantage of individuals' improvement and self-worth. Algerian theory is also uses this approach. Algerian can be quite successful in treating clients with depression, effective behavior theory, and eating disorder. All of these people suffer from eating disorder. Men and women, young and old, can all be victim of this terrible mental illness. Theories found in behavior therapy can be highly effective in treating eating disorder. Cognitive behavior theory, which is abbreviation CBT, and behavioral theory BT have been used for many disorders. Cognitive treatment, they are the most used types of psychotherapy for bulimia. Treatments available for both forms of behavior therapy have been found to be effective means to overcoming eating disorders such as bulimia, which used to treat bulimia, nausea. BT focus on teaching relaxation techniques and coping tragedies that individual can use instead of binge eating and purging excessive exercise or fasting. And so I encourage you to find a good counselor. You could, if you're suffering from depression or any other type of mental disorder. Again, I am Richard Mitchell of Genuine Uniquely RSM Counseling and Advocacy. Be good to yourself and know that you are worth more than you can ever imagine. God bless. Take care of yourself.